Hi, thank you for joining us. Today's topic is going to be about osteopathic manipulative techniques. And so, to give you an understanding of what that is basically me performing certain types of myofascial release, HVLA, functional medicine. The possibilities are actually truly endless if you really think about the osteopathic way. And interestingly enough, I believe that the osteopathic way needs to be preserved, and a lot of people may not understand exactly what that means, but I think that sometimes we have forgotten how important it is that we stay close to our osteopathic roots, and this osteopathic means that we think of the body as a whole and that we consider this when we're treating patients. So this topic is going to be a little bit more information about that. So thank you for joining us. Hi, this is Dr. Jonathan Youssef, networking for your optimal health. Today's discussion is going to be osteopathic manipulative techniques, or the osteopathic way. One of the things that I do in my office that is unique for my practice and for myself is that I can perform osteopathic manipulative techniques. Not many people understand what this is, and basically what I do is, in the osteopathic ideas are that you treat the whole body as a unit. You think of all of the factors that might go into a diagnosis. So, for example, if you have high blood pressure, sometimes you want to think about not just the heart, the kidneys, the liver, the intestines, but you also want to think about the patient's emotional state, their musculoskeletal effects. In fact, I think it's well known that if you're in a great deal of pain, you're probably going to have higher blood pressure readings, and as a result, develop hypertension. So I believe that by thinking about the body as a whole, it's a very important way of looking at people's medical problems. When I'm thinking about the osteopathic techniques that I use in the office, I use something called myofascial technique, and basically, many people just can heal better if I'm able to put my hands on where they're hurting and use something called myofascial technique to release some of that fascia and the tension, the spasms that lead to chronic pain. So by performing myofascial techniques, I can do that. In addition, I think one of the biggest sort of techniques that a osteopath can use is something called HVLA. This is kind of where a patient might feel a pop or a sensation of a crack, and it's high velocity, low amplitude technique. That's the HVLA, high velocity, low amplitude technique. And this technique is something that I teach many of my students in my practice. I do have some medical students that rotate here, and they learn a great deal from the techniques that we show them. In fact, they also bring new techniques that have been recently performed at their medical school. So with these techniques, there's different ones from different schools, and I think we used to call the techniques based on the school that it came from. And for example, there's a Texas twist and a Kirksville crunch technique, and these techniques basically are HVLE techniques that we use to adjust the back and set the fascia and the motions of the planes and the motions of the person's musculoskeletal body into alignment. Keeping in mind that we believe that a lot of the medical conditions, such as gastrointestinal issues, cardiac issues, can be related to the musculoskeletal portion of the body. As that body is interlinked, we believe that some of the thoracic, lumbar, and cervical myofascial, and we call them dysfunctions, these dysfunctions in the vertebra can also reflect a organ or a body that is a part of the body that is out of sync. So by performing some of these techniques, I've been able to relieve some people's chronic pain. And in addition to this, I do add my own recommendations. I do have a system of trigger point injections that I use, a natural one. And there's a company by the name, a product by the name of Tramiel. And this Tramiel has arnica in it, witch hazel, daisy, calamine, echinacea, milfoil, and a few other ingredients. And this, in combination with the recommended injections that I do, I place those in the areas of the mid, lower, and neck areas of the back. And that's where I get some of the adjustments to kind of stick and stay in place. So I have multiple ways of which I can relieve some people's pain, and they are kind of surprised that we're able to do this, but this is the osteopathic way, and I would love to share this with you and also with some of my students in the future. This is Dr. Jonathan Youssef, networking for your optimal health.